But let's stick on with the theme of medicine and health for some time. The HPV vaccine in India. The HPV vaccine in India has begun with already adolescent girls aged between 19 to 13. It's a landmark public health move aimed at reducing cervical cancer, a disease for which India accounts for nearly 1/3 of the global burden. But the question I'm making you think tonight is this. HPV, is it only for the girls? Does the virus impact only the girls? Well, HPV is the most common sexually transmitted infection worldwide. It spreads through skin-to-skin contact. Most people never really know that they have it as well. In women, it causes cervical cancer. In men, it can cause cancers like throat, mouth, tongue, penis, and also the anus. Globally, HPV-related throat cancer in men are rising. In the United States alone, about 20,000 men are diagnosed with HPV-linked cancers each year. But here's the sort of epidemiological challenge here. If boys are not vaccinated, they remain part of the transmission chain. Even high coverage among girls does not fully, we are made to understand, interpret circulation of the virus in large male population which remain unprotected. That is why more than 50 countries, including the US, UK, Australia, Canada, Germany, vaccinate both boys and girls. Australia actually introduced gender-neutral vaccination in 2013, and since then, HPV infection rates dropped by over 90%. The science on this is pretty clear. Vaccination before exposure, ideally between the age group of 9 to 13, providing the strongest protection. The vaccine has been used globally for over decades and has strong safety and effectiveness data as well. So the real question is not whether HPV sort of causes cancer or helps in restraining cancer in men. Of course it does. The question is whether we see HPV vaccination as cervical cancer prevention alone or cancer prevention for all children. But remember, this is not medical advice at all. Please go to your own pediatrician, go to the doctor you take your kids to and ask them if your boys need it too. Remember, for any effectiveness of HPV vaccine, because some of them are expensive when available in the private market, it has to be between the age group of 9 to 13. So it's the preteens that one has to hit before exposure. So next time you visit a pediatrician, do ask them if your boys